Hi, this is Christina with Questions for a Nurse. Again, I'm reading funny stories off of something called ShiftMet. This one says, one evening we had a very confused patient and nothing seemed to calm him down. Suddenly, he bolted out of bed, down a short hallway, and out the usually locked intensive care doors. They had just been opened by a clerk who was letting in some visitors. He headed down the hallway towards the laboratory with his gown streaming behind him. It took a few minutes for us to catch up. He had his hospital shirt on backwards and was otherwise naked. I'm glad there were no visitors in the hallway. Um, this is funny. And I would love to say this is a unique story for the hospital, but again, it's not. When patients get confused, they get very confused. And for some reason, when patients get confused, it seems like the first thing they want to do is take off their hospital gowns or whatever clothes they have on. I've never experienced that. I mean, you would have these patients coherent outside and they would be fully dressed in nice clothes. In the hospital, they get a little confused, and the first thing they want to do is take off that gown. We cannot keep them clothed. We cannot keep them dressed. And it's only, I mean, we do our best to tie things and to snap them together, but those gowns are meant to come off, and by golly, so many patients are good at getting them off. So, and for them to stand up and streak down the hall, again, although it's not normal behavior, unfortunately in the hospital, it can be pretty normal.